needs to be that referee in that support group and say, what's going to happen in here is going to stay in here. It becomes a safe place. So you create a safe environment. Next, please. So, going back to confidentiality, there's certain code of ethics that the Leukemia and Lymphoma Society kind of puts out. And again, each community, each individual support group will develop their own as they grow. But for us, there's 4 basic things. Primacy of patient's interest. The patient's interest is the first thing that, and the most important thing that we envision when we support a support group. Confidentiality, of course. Respect, fairness, and courtesy, and I think those are pretty common human things. And integrity, being able to, if you promise something, being able to deliver. If you promise to create a safe place, then let's create it. Next, please. Next. So, some of the characteristics of the support group participant, somebody that goes to the support group. Be genuine, again, be empathetic, respect in all of what the word means. Obviously communicating to others our sincere belief that they, like everyone else, possess the inherent strength and capacity to make it in life. That's a simple concept. We all know that when you first get diagnosed with cancer, you're a survivor that day because your journey starts that day. And it's when you get to a support group, you will see the strength that others have. And it's that collective strength that will give you hope and that gives hope to others. Next, please. So continuing on the characteristics of a participant. Self-disclosure is the act of sharing our own feelings and experiences with someone in an effort to help that person. That's pretty scary when you don't know anybody. The society has about 7 or 8 support groups that we co-sponsor or that we sponsor directly. And self-disclosure is the toughest thing to have a patient do when they first get diagnosed. They go in and they sit down and they listen to everybody. Next meeting they go, again they listen. Probably by the 3rd meeting is when they feel comfortable and say, here's my story. But the thing to remember is that they keep coming back to the support group. That's the important part, that they keep coming back. And that's where I think, creating that self-environment, and creating that safe environment, and creating that confidentiality structure is very important, to have those folks keep coming back. Concreteness is the act of keeping communication specific in order to get down to pressing concerns. In a support group, you really don't, you want to keep the conversation in some way structured, but at the same time, you don't want to go out in the field and talk about the news and talk about, something that really, maybe somebody else is not really too interested in. So, and again, this goes back to being aware as a participant and also for the facilitator to keep this in mind. Next, please. So, I want to talk about how you can start your own support group in the Fort Defiance area. I know I had communicated with Alan Joyu, and I apologize that I had told you that we were going to do this together, but in the interest of time, unfortunately, we'll defer that to the Q&A later. So these are some ideas. There's structure, there's a needs assessment that we can do. There's, do you have a convenient location for everybody? Maybe it's in Window Rock, maybe it's in an outlying community. Obviously, obtain the proper local facility permits, find a facilitator. This can be the toughest thing to do. But it's going to depend on how you define a facilitator as well. For us, a facilitator means it's a healthcare professional. For you, it could mean a para-healthcare professional, maybe a member of the community that has gone through this, maybe a survivor. So, getting down to those details is important. Decide the number of participants. You can limit it to 8 to 12. Usually that's pretty manageable. If it gets beyond that, then maybe think about 2 groups or two meetings per month. Plan group activities. One of the things we do is bring speakers. So on nutrition, on maybe talking about some of the side effects of the drugs for blood cancers. talking about some resources in the community, bringing a community organization and saying, present your services. What do you have for cancer patients that have no insurance? Something along those lines. Make it a potluck, have a theme if you like, have special speakers like I said, and determine the frequency and time. So I think this is important specifically for a community like for Defiance, where transportation may be an issue, where maybe weather may be an issue as well. So all those things need to be taken into account. Next, please. So here's the role of facilitator. Like I said, the facilitator really is not there to tell the support group, this is how it's going to be, and this is the thing. No, the facilitator is there to really kind of guide the group. Okay, so we're going to set some rules. Here are the rules, but the group comes up with the rules. The facilitator really does the job of almost the lead, but in silence, in the background, making sure that the conversation is going the way that it should, or if there's an issue, for example, I'm really having a tough time getting through making an appointment such and such. Well, maybe the facilitator, if they're a healthcare professional or somebody that's a survivor that knows the community very well, maybe they can actually say, we have a contact here, let me hook you up with him, or I'll follow up with you later on. Something along those lines. That's what a facilitator will look like. Develop along with group members the rules for group. That was important. I want to kind of go back to that because the rules could be, very simple. Be respectful and listen, and that's pretty much it. That's pretty much what a support group rules would look like to me, at least. Or you can get more structure. If there's new members coming in, they first have to be screened. That's one thing that we advocate for in some of the rules that we do. If you're a new member, you need to call ahead before you come. We've had in the past problems where we have protesters because some of the therapies that we advocate for are a little bit controversial. People hear stem cell transplant, and that's a controversial thing to some folks because of their religious beliefs. So we don't want to put anybody in any danger. So we ask all new members to call ahead before they come. So, and again, maintain all the participants' privacy. That's where we advocate for a healthcare professional because they already know things like HIPAA, things like confidentiality and privacy, patients' rights, etc. Next, please. Here are some resources. I know they're small, and I can, I'm more than happy to email them to you or send an actual copy of the document. But these are resources if you want to look at some of the studies, some of the information that we develop, how we develop our support group. These are the resources to go. So again, most of this stuff is also online now. Some of this stuff is a little outdated, as you can see, 1979, but they're still very good guides. Next. So we were going to talk about, if there was somebody that wanted to talk about their journey, but again, in the interest of time, we'll defer that to Q&A. Next, please. That's it. So any questions?